considering plastic surgery, or maybe it's out of necessity and you don't know what to ask, where to go, who to turn to. Well, I invite you to stay tuned to this episode of Unleash Your Audacious Confidence, because today we're talking to board-certified plastic surgeon, Dr. Itzhak Nir, about all the things, right? From facelifts to breast surgery. So if you're considering it, I highly suggest you watch this show. Welcome to Unleash Your Audacious Confidence on Win-Win Women TV. This show is all about sharing the tips, tools, and techniques that will allow you to step boldly in the direction of your dreams, despite your feelings, fears, or past failures, to imagine what's possible for yourself and live the life you deserve. Well, hello, and welcome to this episode of Unleash Your Audacious Confidence. I'm your host, Alicia Couri, and I am super excited to have you on this show today. This is something that I've been wanting to do on this show for a long time, so I'm glad that we're getting an opportunity to do it. But before we get to our guests, I do want to encourage you to go check out Win-Win Women. We have so many amazing show hosts. This is a platform for women to really learn from other women and grow and develop and connect. So I encourage you to go to winwinwomen.com to do just that. Now, on with the show. Today, we have a very special guest. He is Dr. Itzhak Nir. He is a board-certified plastic surgeon, and we are going to chat with him about all the things that we as women need to know so that we can be confident when we step out. So, Dr. Nir, thank you so much for joining us. Hi.
Hello. Hi, how are you?
I'm great. And I want to start just by educating our audience a little bit between the difference between a board-certified plastic surgeon and any other type of certification that your surgeon might have, because this is an important distinction when you're looking for someone to work with you, right?
Right. So it's very important when you are interviewing a surgeon for cosmetic surgery that you go to a surgeon who's certified by the American Board of Plastic Surgery. It's really the only board in the United States which certifies plastic surgeons through the residency trainings and completing all the necessary requirements to become a plastic surgeon. There are other, there's some other I'd call them pseudo boards out there, but they're not really at the level of the American Board of Plastic Surgery. So that's the first thing I would do. Just check to see if they're certified by the American Board of Plastic Surgery.
Excellent. Because people can just think, oh, I'm picking someone, they've been certified, and you're not really understanding the difference.
Do your research.
Yeah, do your research.
Very,
really
very important. Very important. And then definitely meet with the surgeon. You don't know how many patients I've had to fix. And I ask them, well, did you ever meet the surgeon who operated on you? And they're like, no, I just met with their coordinator. I'm like, really? Okay.
So you see, that's a really important tip. Have a consultation with the actual surgeon that's going to be cutting you open.
Yes.
If they're saying, no, you do everything kind of either on Zoom, or you're just working with the coordinator in the office and you've never met the surgeon, because you need to ask certain questions, like what are some of the key questions when looking for a surgeon to cut you open, basically, when looking for a surgeon, that you should really ask first?
Well, first thing you do is you have to make sure you and your surgeon are on the same page with what you're looking for. So the doctor has to really be able to examine you, listen to what you're saying, okay? Because it's really important, because you could talk about anything, but if you're saying one thing and your surgeon is saying no, but this, then you really have to make sure that you and the surgeon are on the same page. So you have the expectation of what you want, and the surgeon knows what you want, and he could tell you if he could deliver it or not. So make sure first of all, you get along with your doctor, right? Very important.
Yeah.
If you get along with your doctor, that's really good. Ask him his history. Ask him, is he comfortable doing this procedure? Ask him what his experience with the procedure that you're looking for is. It's okay to ask a doctor if he does a lot of these procedures, it's
Right.
fine. Ask to look at his before and after photo gallery. Ask if those are really his photos, because you'd be surprised. Sometimes the photos on there are not the photos from the doc, right?
Oh, ooh, that's interesting. Like, we had a brief conversation before we got on, and I was talking a little bit about my experience with the surgeon that worked with me when I had to do my partial mastectomy and then reconstruction. And the first surgeon, she was just strictly a breast surgeon, cancer, like removing cancer, and she had recommended a mastectomy, a complete left breast mastectomy for me. And the thing is, just like what you were saying, ask questions, like I was asking, do I have any other alternatives? What are the, she was just really about, well, no, I think if we do this, you don't have to worry about cancer anymore coming back in that breast. I'm like, of course not. I wouldn't have a breast because of course I'm not going to worry about cancer in that breast. So I didn't get good vibes. Like I didn't feel like we had chemistry, like she was really listening and trying to work with me. And that's when I started looking for other options because I didn't really feel. So I think some people don't feel like they have that permission to do that.
Right.
To like say, wait, whoa, time out. You're not really hearing me. This is not what I want.
Right.
So
Communication is key.
yeah.
And don't trust Dr. Google all the time. Okay. So
Don't always trust Dr. Google, right? Yeah. So I want to switch a little bit into, let's talk about when a woman should really consider plastic surgery for herself. Like if
sure.
she's looking at different parts of her body, because you really work on the entire body. You work on any face, neck, breasts, tummy
Tummies,
tucks,
lipo, the whole deal.
butts, the whole thing, the whole shebang.
Shebang.
So when should a woman really consider plastic surgery as an option? I don't, that might be a loaded question, but give it a
Yeah.
shot.
The best answer that I can give you for that is when a patient feels that they are ready to have a surgical intervention, okay, to achieve their desired goals is when you should approach a plastic surgeon. A good plastic surgeon will tell you that you are not a candidate or you are not ready. Um, a bad plastic surgeon, or a greedy plastic surgeon, unfortunately, will just, tell you, yeah, whatever you want.
Hmm.
But the key is when I have a lot of women who come and see me and they ask about certain things. I don't look, I don't think you're ready for it yet.
Mm-hmm.
In a few years, you'll be ready for it. But there are some telltale signs of aging on the face, jowl, early jowl formation, deepening
Mm-hmm.
of the nasolabial folds, cheek skin laxity, droopy brows, excess upper eyelid skin, the little bit of
Right.
loose turkey neck.
Yeah.
Uh, and it happens to everyone. The best thing is genetics, right? If you've got good genetics, if your mother looks great when she's 70, odds are you're going to look great when you're 70, right? So,
Yeah.
that is key.
Do you do any kind of psychological testing or evaluation?
I
And
evaluate every single one of my patients. I don't have a formal evaluation, but
yeah.
if you've been doing this long enough, every single patient is evaluated because, sometimes you're listening to a patient, they're focusing on something, and you're like, whoa,
Mm.
I, I don't want to do this.
Yeah.
Because they're never going to be happy. It's unrealistic expectations. And that's what you have to, as a surgeon, that's what you have to be really concerned about when a patient has unrealistic expectations. And
Mm-hmm.
your job as the surgeon is to explain to the patient what you can accomplish, what they can expect, and what their options are surgically or non-surgically.
Yeah. So let's go back to that mental question. How should someone really prepare mentally and emotionally for surgery, because the aftermath, the post-surgical, you don't look anything, like you come out of surgery thinking, oh yeah, and it takes weeks, sometimes months, for the swelling and for the things to get back to normal
Mhm.
and everything. So how do you prepare your patient, or how should a woman think about post-surgical expectations?
I tell my patients it's baby steps. Um, and it gets better and better and better, over time. Everyone's going to swell. Most people are going to bruise. Everyone's going to have, a little ache and pain and, a little discomfort after surgery. Some surgeries, worse than others. Um, and it's just expectations. If you talk to your patients and you explain to them, this is kind of the process and how it's going to go, most patients are understand and
Mm-hmm.
they expect it. And it really comes down to communication. It
Yeah.
really comes down to communication.
I did not expect to get a drain put in, because she didn't think that we would need one, but then I ended up getting a drain, and that was like,
Yeah. Patients don't like drains.
drains, no.
They're annoying. That's my biggest complaint when I do surgeries and I have to put in a drain. It's like, when can you take this out?
When can I take it out? It's
Yeah.
Listen, it's disgusting, right?
That's
It's
not
just
disgusting.
it's
It's a
disgusting
necessary evil. Just consider it okay.
to see the fluid coming out of your body. Nobody wants to see that.
Better than it
That's
sitting in there, though, right?
But I don't want it in there, right? I don't
There
want
you
it staying in there. But
there you
I know it has to come out, but it's still like, ooh, when you're squeamish. But so it's really about communicating and having a good rapport with your surgeon. Don't be afraid to ask questions. Don't be afraid. And so if a surgeon is like rushing you and not giving you the time to really ask the questions, how that isn't someone that you need to work with.
right. You got to feel comfortable. You
Yeah.
got to feel comfortable. Um, you'd be surprised how often patients are afraid
And
to
that, yeah.
say something or to express themselves, But no, you have to be comfortable. I mean, usually with cosmetic surgery, look, you're paying for a service, right? And it's
Hmm.
usually not cheap. Okay. And you have to just be comfortable. Talk to the doctor. Make sure you are heard. Okay. It's
And
very
that's like, yeah, I wanted to do the show for women to understand that you have a voice. This is your surgery. Like, this isn't this does not belong to the doctor, in other words. So you have to really advocate for yourself. You have to make sure you're comfortable. Tour the facility, look at the things, see what it looks like, feel comfortable with the people working there, because they're going to be taking care of you when you come out of surgery. You don't want to be in a situation where people in the facility are ignoring you or rude, and you're coming out of surgery and you're feeling groggy and you're feeling, out of kilter, and they're trying to, you know,
right. And be weary or worry, whatever the word is, if they try to hide it from
yeah. Yeah, you have to do your homework, like you're saying, do your investigation. So is there a particular type of uh time frame? I'm trying to make sure that I'm asking a sensible question, because is there a time frame that you typically would go between a consultation with someone to actual surgery? Do you have like a
it. It
time
it var-
frame?
varies by patient. Usually, it's going to be most probably a couple of weeks, at the
Mhm.
minimum, right? Very rarely does somebody come in and have surgery the next day. That's not how, at least in my practice, that's not how it works.
Right.
Um, because we have a whole pre-op regimen that we do with our patients. We get lab work. We make sure that they're healthy. Some patients need medical clearances to make sure that
Mhm.
they can tolerate anesthesia. So, I mean, it depends on the patient, but, I would say it's at least going to be 1 to 2 weeks at the very minimum before.
Right. So nobody's coming in for no emergency facelift. Listen, that's not.
No, no, there's only one cosmetic surgery emergency, they say, right? That's a patient from out of town paying cash. So,
Hmm.
yeah, that,
Yeah,
that, that's
that
a bad.
doesn't always happen. That doesn't always So I now want I want to talk a little bit about, because I did mention it earlier, about breast surgeries and breast reconstruction. And
Sure.
uh so for anyone who's had a mastectomy or has been um they've been told they need to have a mastectomy, what type of, back to the time frame, and I know everybody heals differently, but what is generally the time frame from mastectomy to reconstruction?
Depending on the type of mastectomy and the type of reconstruction, because you can have autologous reconstruction, which is where you use your own tissue and recreate the breast. Sometimes you can use your own breast tissue, like kind of like what you had, right? They rearrange
Mhm.
the tissue. Sometimes you can't do that, depending on the type of cancer that you have, and the whole breast tissue needs to be removed. Now, when that happens, you could either use your own tissue, like a muscle flap or a muscle skin flap or a free flap where you take tissue from somewhere else and bring it up, or you can do it with a expander and implant, which
Mm.
is you put it in, it's almost like a balloon. You put the balloon in first, you blow it up to create the breast mound, then you swap it out for a permanent implant. And then you could tweak it afterwards a little bit with, adding a nipple, adding some fat, as a fat transfer, fat grafting for contouring. But if you're doing a full mastectomy, and you do expanders and implants. Usually, at the very minimum, it'll be 6 weeks, but it's usually closer to about 3 months
Mm.
for the expander. And then the second stage surgery where you take out the tissue expander and you put in the permanent implant.
And you suggest that anyone who is being, I guess, steered in that direction to have a mastectomy, to bring the plastic surgeon into that conversation really early in the stage.
Usually, most of the surgeons who perform the mastectomies will have me, once they've decided that, yes, this patient needs a mastectomy, then they'll refer the patient to me for an evaluation. And then I can, see the patient, evaluate, tell them, what I think can be done, how it should be approached, and we go from there. And then, I speak to the surgeon, we find a day and we coordinate it together.
Mm. So will you be there that same time as they're
Yeah,
doing
it's done.
that
It's
surgery?
all done at the same time.
It's all done at the same time.
Surgeon performs the mastectomy. Once they're done, I come in and do the reconstruction. And so it's the first stage is usually done all at the same time.
Oh, see, I did not know that. Look at that.
Yeah,
I
there you
didn't
go.
know that. I thought it was like yeah, you do this and then you come over here and you do that. And then I come back to you and you look at this, and then that it's like a ping pong back and forth. But yeah, it's all done. It could all be done at the same time if it's coordinated with the surgeon, with both surgeons at the same time. Um,
And that's usually how it's done. That's usually how it's done.
uh, Set some expectations of reconstruction for me, because there are those who look at the Hollywood reconstruction and say, okay, I'm going to have a mastectomy. I'm going to come back out and I'm going to have these beautiful, like, um, whatever breasts, right? These perky, beautiful breasts. And then there's some that come out and say, oh my God, I had no idea that reconstruction was going to be so hideous.
Oh,
So, like, set some real expectations that women should be considering when they don't have a choice. And it's like, this is what it's going to be.
right. So the first thing I tell patients when they're talking about having reconstruction after a mastectomy is it's not a breast augmentation, right? A breast augmentation is an aesthetic additive procedure. You're enhancing the breast that you already have.
Mm.
Doing a breast reconstruction, you're trying to rebuild something that was removed. You were surgically deformed, right? Quote unquote, surgically deformed for in order to prevent the cancer from spreading, or and to
Hmm.
treat the underlying process. So what you try to do is you try to build an aesthetic breast mound, something that will resemble a normal breast as best as possible. Okay. And that's really how I state it. We do
Yeah.
our best to make it look as good as possible. Sometimes you hit a home run and it's like, wow. And
Mm.
sometimes, it's, it
It's the
depends on
best that you could do
depends
with
on
the
what you get, right?
right. It's the best that we could do with what was here.
But the effort is there. We really try to make everyone symmetrical and as happy as possible.
Yeah. Well, I know the effort is appreciated, but I just wanted to have
Mhm.
some clear expectations because yeah, even for like I had someone confide in me one time that her husband was saying, here I was thinking that we'd have all these, these beautiful breasts and we got this, and it's like she just had stage 3 cancer, had to have
Yeah.
complete double mastectomy. And here he is thinking, ooh, we're going to have these.
Well, it wasn't explained properly to them.
Right.
Once again, we're going back to communication, right? The
Back to
initial back to
communication. You need to
communication.
communicate with your surgeon.
That's
Yeah.
right.
Um, how about explants? Because I know a lot of women who are having
Mhm.
explants because of now implant sickness.
Right.
And what's kind of being done in the research side of implants? Is there anything that women can expect on the cosmetic side, not the reconstruction side, for
So,
implants?
so do, the number of explants has definitely gone up. There's a lot of fear out there with breast implant illness, or silicone implant hypersensitivity syndrome, we call it as well. Um, and some women, not all women, but some women who have silicone implants and some saline, but usually it's silicone, um, feel almost like autoimmune symptoms
Hmm.
from something in the silicone gel, right? And it's almost like, some people, this is my opinion, right? Some people are allergic to peanut butter, right? Some people are
Right.
allergic to bee stings. Some people, dandelions make them go crazy. But some people are sensitive to silicone implants, and it's not going
Hmm.
to be everybody. So that's one thing. And there's a lot of fear out there, and the media sometimes scares people a little bit too. But if you feel that you are having, symptoms from having your silicone implants in place, first thing I would do is I would get an autoimmune workup, right? Make sure that it's nothing like lupus or some autoimmune,
Right.
because they mimic the symptoms. If that has been ruled out, then at that point I would recommend taking the implants out. And a lot of times what I do is I take the implants out at the same time we do a lift. So we shape the breast at the same time. They're going to be smaller, but they'll be perkier, right? A lot of
Hmm.
the times. And you'd be surprised a lot of times if the implants come out, the breast good. They're just,
Yeah.
you're just smaller.
Yeah. Which, I don't have a problem with that. I did not have a problem with that at all. Um, in the time we have left, share a little bit with our audience some of the latest technology that you're seeing that you're excited about when it comes to surgery and plastic surgery. What are some of the things that we can look forward to that might be less invasive, but a little, give us great results?
Right. I think one of the newest technologies that's really gaining a lot of traction now, and we've seen it, get more and more and more um, prominent, is a lot of the radio frequency microneedling type treatments, right? Like the Morpheus
Hmm.
8, because it's really been shown to improve the tissues and tighten the dermis and give you that kind of youthening effect without a lot of downtime, which is the key. Now I've been doing lasers for 20 something years, and lasers work great too,
Hmm.
but you're going to get some downtime with lasers, and you're also limited by things like skin color, because like darker skin, you have
Yeah.
a chance of discoloring, getting hypo or less pigment, sometimes darkening pigment. So you got to be careful. But the radio frequency microneedling, those energy-based procedures have really been shown to improve the texture of the skin and the elasticity of the skin with very little complications. So that's something that I think has really improved, the way that we approach the aging skin. Now,
Mhm.
nothing replaces surgery if you need surgery.
Right.
Okay? It's
So
like
like
putting
if your eyelids are drooping past your eye and you can't
right.
even open it, that's surgery.
If you have extra skin in your eyelids, nothing's really going to make it go away unless you cut it out and shape it. Same
Hmm.
thing with the face. If you have a lot of loose skin on your neck, you could do the radio frequency microneedling. You could do a little liposuction, but guess what? You're still going to have loose skin on your neck.
Yeah.
You gotta tighten it up and you gotta fix it. Now after that, as the skin continues to age, you can use all of these ancillary procedures to maintain what you have.
Hmm.
So it's all additive. It just makes it better. All these technologies just make what we can do surgically better and help extend the 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 time period of that youthfulness,
Hmm.
that you can achieve.
All right. The last one I want to ask about are eye bags because I get
Oh,
this question all the time about eye bags.
okay.
Like, so how can women
Is that an
really,
Apple product, eye bags?
yeah, I
I'm
right.
sorry. I'm sorry.
They should market it, but yeah. So how I get it from men and women. I get a lot of questions about
Sure.
droopy lids and the eye bags.
Right.
So how can they um what kind of things should they look for that need surgery versus a cream?
Okay. If you're looking in the mirror and you have big puffy bags under your eyes, a cream is not going to work to make it go away. Okay. Um,
If it's like bulbous,
if
if
it's
it's like
yeah, that's not gonna
that's not
it,
a cream.
it's it's the grade in which you have the aging of the eyelids. Like, so, if you have just some crepey skin, sure, we could laser that. You could put some, a good hydrating cream on there, which will improve it. You could put that little plastic stuff that tightens. I forgot what it's called. You see that advertised on TV. I think that's kind of funny. Um, but if you have, bulging bags, you need them surgically removed. Now, sometimes we can do it from inside of the eyelid and just take out the fat if your skin is relatively tight, and that works great. And sometimes we actually have to open it up and, take it out and then take skin out as well. So, there's different approaches.
Well, thank you very much. That's
Yeah.
interesting. Yeah. So, so I am going to anybody who comes to me and asks me about their eye bags and their droopy eyelids, I'm going to tell them talk to Dr. Nir because
Okay.
I don't know nothing about eye bags. I can just help cover it up for you. But I really appreciate that. Anything that I did not ask you that you think um women should know out there
I think
about?
there's a really, some really important statistics. Women who have cosmetic surgery have a significant, and men too. Okay, I don't want to be sexist. Men too show a significant increase in self-esteem and
Mhm.
quality of life. Okay, I remember, before I started, people were like, plastic surgery was like hush hush. No one would talk about it.
Yeah.
Where's Jane? I don't know. Oh, she's so much younger now, right? But now people are out there, videoing their surgeries for God's sakes and showing it
Yes.
to
Uh-oh.
every one of their friends.
Right.
So, the stigma of cosmetic surgery hopefully has disappeared, and people see it for what it is. It's a way to improve your self-esteem and to give you hopefully a better quality of life.
Yeah, I agree. Well, thank you very much. That's a great bow to wrap everything up with because it does. This show is about boosting your confidence, and
Right.
it's not. It doesn't have the stigma that it used to have attached to it. How many surgeries have you had? And Dr. Neer is not the type of surgeon that is trying to, rack up more and more surgeries under his belt in an unethical way. It's more about you and how it impacts you. And that's this whole show has been about you having confidence to go to your doctor, have the conversations. We didn't really talk about other rejuvenation types of surgery, because I know there are other types of rejuvenation surgery for women aside from the breasts, and we can go lower and lower and lower.
We could talk
But
in the
yeah, we'll talk about those things in the future. But there are a lot of things that you can do, but you have to feel confident enough to have the conversations with your doctor, be open, and ask the questions that you need to ask. So I really appreciate you coming on and sharing this with us, Dr. Nir. And if you wanna connect with him, we have all the ways to connect with him in our show notes so that you can reach out and have a conversation with Dr. Nir. Thank you so much for joining us today.
Thank you so much. I appreciate it.
And I will see you all next time on another episode of Unleash Your Audacious Confidence. So with that, I'm going to say to be bold, be brave, and every day do one thing to step out with audacious confidence. I'll see you next time.